Good morning, healers. My name is Ben, and this is the Moss Report. So we're on location here at the Stella Maris Clinic. Currently, Dr. Alvarez and Dr. Moss are having a conversation in his office, as you can see. We're trying to keep quiet, and we've been asking the staff to try to help us do that. But it is a busy location. There's patients coming in and out.
I come from a family with a high incidence of cancer. Mm-hmm. My mother, pancreatic cancer. Mm-hmm. My father, prostate cancer. Mm-hmm. My two brothers, prostate cancer. Mm-hmm. And there's a third brother who has high PSA, but he's 84. Mm-hmm. We don't want to touch, we don't want to take anybody, but it's possible that he might also have. My father,
Yes.
We found it when he was very advanced cancer. My colleagues thought that he didn't have more than 6 months to live the way he was heading. Mm-hmm. True. Mm-hmm. And we had to use a lot of radiation, and that's all. Mm-hmm. And we had a tumor board. I was, already under alternative medicine, and everybody recommend he should go with an orchectomy, which removing his testes out. Mm-hmm. It was a common agreement. I said, no, it's my father. I won't do that. It's my father. Mm-hmm. So by that time, I was already involved with treatments in Germany. So I put him in a therapy that I learned down there, and he recovered as well.
Can you show us around?
Absolutely.
Yeah.
Actually, well, as you can see, this is our reception desk, and where Linda is receiving the patients, and the nurse will take care of the vital signs, waiting the patient, and so on. So this is where we move around, okay? We'll proceed with our small kitchen. This is where we prepare our meals, our breakfast and lunch. This is our cook. So this is a short break because we don't work with big groups. This is where we prepare our food.
I understand.
Okay, so we proceed. We're going into our treatment area, and this is where our patients get their IVs. Typically, we use the combination of in high dose in conjunction with high dose vitamin C, DMSO, glutathione, alternated with alpha lipoic acid, and so it's a process that takes about 3 hours through a slow IV drip. So this is one of the basic metabolic therapies that we've been using, and we've been adjusting the therapy as we continue, working. It's our recliner where we have our IV treatments every day, Monday through Saturday, and on the left you'll find my office where we admit our patients and make a clinical history, checking, running all the testing, and we advance into what we call our hyperthermia unit. We have 2 units. This is the whole body hyperthermia on the right, and at the end you see this equipment, which is the local regional hyperthermia, and they work in conjunction. First, let me start off with the first one, with the whole body hyperthermia, where we provide the temperature which comes from the upper portion of the tent, and the patients are laid down here. We cover the whole body and leaving the head out of the tent. So the temperature initially goes through the skin. From the skin comes into the fatty tissue, and from the fatty tissue travels through the blood, reaching all cancer cells and respecting normal cells. So it's a process that takes about 2 to 3 hours, and temperature is raised from 37, and we can go up to 39, 40 degrees. And that's the process. So by doing this, the action that we have is we are making the cells more sensitive, since it affects the membrane, the proteins, and it changes the atmosphere where we can kill cancer cells, a process called apoptosis. This is enhanced by the use of this hyperthermia. We keep monitoring the patient. We have this monitor where we can check the oxygen saturation, we can check the blood pressure, the pulse, continuously during the process. So this is a Haeckel unit, is a Haeckel T or HT2000 brought from Germany. And this is a nice equipment. I feel very comfortable working with it. I think that you don't find many of these units in Mexico, and I'm very impressed with that. So, and this other one
May I ask a question?
Yes, please.
So I've heard that some clinics utilize the administration of chemotherapy drugs in conjunction with the hyperthermia process.
Certainly. The advantage of this hyperthermia, by making the cells more sensitive and also increasing the permeability, we have the advantage that we can use a low-dose chemotherapy or low-dose radiation therapy. When we talk about the low-dose chemotherapy, we're talking about only cutting down to 70% less chemotherapy. So in practice, what we're doing, we are heading the therapy to the cancer cells in a more directed way and avoiding toxins. So it's a healthy procedure that we do in Germany, and in certain parts in the States, it is allowed to use in conjunction with low-dose chemotherapy or radiation. That's the only way you will be accepted to take hyperthermia. Not ourselves. Ourselves, we can do it with chemo radiation, but also we can do it with biologic therapy, which is natural therapy. And also makes it more attractive when we combine it with this other modality, which is a local regional hyperthermia unit. Also, this is brought from Germany, and we're doing fantastic work with it. So, but again, the advantage of this unit is it penetrates deeper. So we can work with patients from inner organs which had been high risk to get them under surgery. So on unoperable tumors, this is another approach where we can fight the cancer in a conservative way. Again, using in conjunction, if necessary, with a low-dose chemo or radiation therapy. So those work in conjunction very nicely. I'm very happy having these both therapies available for our patients. Patients don't have to go to Europe or traveling far from here. I mean, they can get them closer, and that's available. Thank you. In Mexico City, when in China, at Shenzhen, working with the enzyme therapy, Mr. Haeckel. This is a certificate.
The following segment is an edited version of the full clinic conversation available at themossreport.com.
Good morning, Dr. Mas. Nice seeing you again.
Nice seeing you, Dr. Alvarez.
Yes.
You don't look one day older than the last time I saw you.
Oh, please. Actually, I think that happened when we first met at the Imperial College in London, when we both were speaking. Remember?
Yes.
Yeah. And then we went into Abu Dhabi, in the Saudi Arabia, and finally at the Cancer Control Society. So it was always nice talking to you, and thank you for allowing me to participate in your interesting video.
Thank you. Well, it's our honor and pleasure to do so. And also, we have some common history even further back, because I knew Dr. Manner, and you were his associate. You were his medical director, right? Harold
Correct.
Manner. Yeah. So he and I actually were roommates for a very short while. We were on a lecture tour together in the 80s. So yeah, I do remember you from as a slightly younger man in those days. But anyway, it's a great pleasure to see you again. And uh, I'd like to talk to you in a way. I'll ask some questions and you can expound however you wish,
Sure.
to give our viewers some idea of what's unique and distinctive about Stella Maris Clinic. It seems like you've gone more in the direction of immunology and just a more comprehensive program. Could you describe your basic
Absolutely.
program? Yeah.
Absolutely. Actually, I got involved mostly after I had attended a symposium in Shenzhen, China, where
Mm,
they had made combination with immunotherapy, specifically dendritic cell therapy, in
mhm,
conjunction with hyperthermia. And
mhm,
they had a casuistic for almost 10 years, where melanoma patients that had metastasized into the liver were under remission for 10 years. So that
mhm,
really caught my attention. And that's when I move up into that field of hyperthermia. And I have lucky to get one of those units from Germany. And that's one of the units that we're using at present time in conjunction with a local regional hyperthermia, which is also brought in from Germany and is doing very nice combination with these modalities.
Now, is that Oncotherm equipment?
Oncotherm, exactly. That's Oncotherm, exactly. And so actually, last week I just released one patient who came to us. This was a 43-year-old woman who had breast cancer that had metastasized into the lymph nodes in the armpit. So he had undergone radiation, chemotherapy, and still the cancer relapsed. So they want to do more chemotherapy, more radiation. He said, no, that's it. That's enough. She came to us. We got her under the program with both modalities, both hyperthermia and immunotherapy. And after dealing with pain for 1 month, for almost 3 months, I'm sorry, where at the end the pain had increased and he had to go into morphine for the last week. So it was a severe
Yeah.
pain condition, and interestingly, after the third day of treatment, the pain subsided.
Oh,
Amazing. Yeah, he
yes.
did not require any more pain relievers, and the tumor shrank in a good 30-40%, and it became softer. Amazing. And this is one of the indications of the local regional hyperthermia when patient relapse after radiation or chemotherapy. Fantastic. Very motivated, very encouraging results.
Yes. And of course, the people should understand that the combination of hyperthermia, local regional hyperthermia with chemotherapy or radiation is an approved and proven treatment for certain kinds of cancer. So there are large randomized controlled trials in cervical cancer and in some other kinds of cancer to document the effectiveness of it. I just have this image in my mind of the kindness of the
Yes.
way the people were treated at your clinic. It was it was such a contrast with, the sort of cut and dried way that so much medical care is delivered in the United States, that you seem to see the person and not just the disease. Would that be a fair characterization?
Exactly. Yes. Well, that's one attractive point of view. I mean, where we our priority number one is quality of life. I mean,
Hmm.
so we treat our patient as a human being, not as a number, as it happens in conventional centers,
Yeah.
and people really like that, and so we that's very motivated. Patients see that all this through good eyes, and that's very nice to hear their comments about it. Thank you.
Yes. The the big news, I guess, in oncology of the past 10 or so years has been the rise of immunotherapy. And I know that this is something, I won't say that it came out of alternative medicine, but it certainly, immunotherapy for a long period of time found a home in a lot of the alternative clinics. You didn't hear it being talked about very much at all in the conventional medical world until about 2011, and then really in 2014, 2015, when Opdivo and Keytruda were approved. Then,
Mhm.
of course, it was like a revelation and a revolution in oncology. But you were doing or calling immunotherapy, I mean, many years, right? Before that.
Sure. Yes, we got involved with immunotherapy, and actually, uh, we really promote the use of the autologous vaccine, for instance, where it
Uh,
has to do with, is a vaccine made up from the patient's own blood, where we separate, the white cells from the red cells, and actually, uh, what we get is antigens from a fraction of antigens where we'll be attacking directly this microorganism, mycoplasma or mycoplasma like organism, or even tumors, peptide tumors, and we are stimulating the immune system to fight against this condition. Also, we are working with dendritic cell therapy
yeah.
as well. This is another issue, and natural killer cells. So this is the program in conjunction with mistletoe or Iscador, vitamin A high dosages, and we keep exploring options that will help our immune response in our patients in conjunction with our biologic therapy and the hyperthermia.
It's quite a comprehensive program that you've developed over the years. Do you ever find the need for uh, standard therapies like surgery, radiation, chemotherapy? Do you ever use those, or what, or how do you handle the need for diagnostic X-rays and that sort of thing?
Sure. Well, actually, even before coming, we made a contact with the patients, and specifically, we request for the pathology report, and it's possible the latest scan and a brief summary on treatment they've been going through, uh, and that will help us to evaluate which therapy we'll be using in each particular individual. So,
Mm-hmm.
and when they come when they come to us, upon admission, if we don't have any updated studies, then we will run our own. So we have access to laboratory tests where we can request, the basic comprehensive analysis, uh, tumor markers, and also CT scans or MRI, whatever study will require it. We'll have it. We have it available, and this is part of the program.
And I mean, people should understand that this is an outpatient clinic in downtown Tijuana. And I assume that the patients are coming, they're staying at a hotel nearby. Um, I think I remember that there was a nice hotel just within walking distance of your clinic. Am I right?
Sure, correct. Yeah, we have two different options. Actually, across the street, there's a hotel where rooms are confined with a kitchen, so where they can cook themselves. I mean, get uh, their food made for the weekends or for late night. Um,
Mhm.
and that's one of the options. The other one, which is a very nice place, is only at walking distance, 3-4 blocks from here, and but still the shuttle service is provided in cases the patients don't want to walk, back and forth, and that's also available.
It's a great pleasure to speak to you again and see you looking so well. And I wish you the best.
Thank you very much, and it's been my honor having you in your program, Dr. Moss, and I really have a high respect for you and your team. Thank you for visiting our clinic, and stay well, and God bless you.
Thank you.
For the full-length, unedited segment of this conversation, please visit themossreport.com. A pleasure to meet you. Thank you.
You're welcome, sir.
So, this is the way things are happening down here in Tijuana, Mexico. For the Moss Report, I'm Ben Moss. How are you healing today?